All right. Thank you so much, everyone, for joining us for our second HPN Awareness Week webinar, Bathing Practices in Patients with Central Venous Catheters. I know this is a hot topic among both folks just starting out and folks who have been doing this for a while. We're always trying to find what the best practices are, what works for us, what's the safest, and Mary is going to talk about that today. I'm going to give my little housekeeping spiel again, just so folks are familiar with the webinar platform. So it will just be Mary and her presentation that you will see. You don't have to worry about your own microphone or video in this format. We won't be utilizing the chat just to minimize distractions, but at the bottom toolbar, you should see Q&A, and you're welcome to utilize that if you have questions that pop up, and Mary will do her best to answer them if we have time towards the end, but she will probably answer many of them as she's presenting. This webinar, like all of our webinars this week, will be recorded and made available at oley.org/webinars at the end of all of our HPN Awareness Week events. And just a reminder, the information provided during this and all of our presentations is for educational purposes only, and is not intended to be perceived as medical advice. Although much clinical information is peer-reviewed, you're advised to consult with your healthcare team before making any changes to your own care. And the statements and opinions of the guests do not reflect those of the Oley Foundation. Very quickly, I just want to share with you some additional events that are happening. Tomorrow, we'll have another webinar conversation about some of the shortages that are happening and what's going on in the community to address those, both short-term and long-term. And later that evening, we'll show a video, a pre-recorded video of some interviews with some long-term PN consumers, just talking about some of the initial challenges that they experienced starting out and how they addressed those and developed advocacy skills and support systems. And then lastly, we'll hear from Dr. Baskin, who is an interventional radiologist, about CVAD patients and their providers. So it is not too late to register for those. Oley.org/HPN_awareness_week. You can see it on a lot of our social media channels. There'll be links to register there as well. So without further delay, I will stop sharing my screen and I will kick it over to Mary. If you would like to pull your screen up, you're welcome to do so. I can help you if you need it. Perfect, looks great. And I'm going to mute myself
so you can see it now.
And I'll spotlight you.
Okay, and everybody can hear me?
Yes, you sound great, and we should be able to see your video, and you are good to go.
Okay, perfect. Good morning, and thank you for having me, Maisie Sear and Oley, and happy, and I'm so happy to be with you on Parenteral Nutrition Awareness Week. Just a teeny bit about me. I've been a nurse for 40 years and working with central line care and patients with central lines for all of my career, off and on, doing education. For the last 15 years, I have been working in the home parenteral nutrition department at Boston Children's, and I do a lot of the education from inpatient to home, and then keeping everybody safe at home with their central lines. So enough of me, and on to how did this topic of bathing and showering with a central line and how to keep the site dry. A few years ago, this became a passion of mine when a patient came in and we were teaching him how to take care of his line. He was a college student. He played sports. He ran. He wanted to take a shower every day. And I said, oh, well, let's work on this. And he said, nope, I don't want you to talk about it. I want you to demonstrate. So the next day I came up and we put on his, in the shower, we put dressings and all sorts of types with Aquaguard and Tegaderm and Tegaderm with Press and Seal, and we did all sorts. And then we took a bet who was going to keep their dressing the driest, and we squirted the shower all over all the dressings. And sure enough, his was the most successful. So they still got slightly damp. So that's how I really started this kind of mission, and it's been a few years in the making, but we will get there. And now I'm trying to move my slide forward, and I don't know why it's not, sorry.
It's okay. If you click it or use the right arrow, one of those should,
Yeah,
yeah, just,
I'm doing the right arrow. I don't, it's not moving, I'm sorry.
that's okay.
So I wonder if it's not moving.
That's
Oh,
all
there
right.
we go. I don't know. Okay, sorry.
No worries.
Um, so in my head, I was, saying, okay, this is what we have. We have a dressing with a central line. This is where it is, to remind myself that it is in a large vessel and we have to keep everybody safe. So I carried on and I've asked patients, how do they take care of their central lines? And I got so many varying answers and anxiety and so forth. So, but today I want to share how I have worked for the last 2 years to help keep central lines safe and patients at home with central lines. So our learning objectives for today is to identify the benefits and risks of bathing and showering with a central venous catheter, discuss current bathing practices in a home parental nutrition department, and identify a safe bathing protocol to mitigate the risk of associated infections and or complications. So again, a little bit of the background. There was a very varying, a varied practice with patients with intestinal failure. Lots of anxiety surrounding showering, and really limited educational materials available to patients. Don't bathe for the first 7 to 10 days and put a plastic covering around your chest when you're showering. Not a lot of good information. So off to the library I went and worked with the librarians to do a literature search. And these are the 4 articles that really stood out to me after reading many, many articles. But Gallotto in 2023, bathing and showering increases the quality of life. So important. And our patients, we talk about that all the time. There was a study in 2020 from Smith that had dialysis patients, and there were actually a couple other studies with dialysis patients that they actually took the dressing off. And although not a significant increase in CLABSI, there was a CLABSI, they had an increase in CLABSI. So probably not the safest. We did in the hospital, there's many studies showing chlorhexidine wipes decrease CLABSIs in hospitalized patients. No literature on outpatients, and is that a great quality of life and cost effective? Probably not. Covering the needleless connector, we know that really helps protect in the shower, and we can talk about that a little bit. I did highlight the chlorhexidine, article, and there were multiple, because it really did decrease, but between cost and quality of life, probably we need some sort of solution, but that might not be the best solution either. So then after my literature search, I went and said, okay, I need the real information from the families. So we developed a bathing questionnaire, which took a while because we put it through the education department. IRB waived the consent form, and then it was sent out to 150 patients, and it was blinded email and red cap. And then we were able to send this questionnaire, a very simple questionnaire. How how do you bathe? How often do you bathe? What do you cover the central line with? And what kind of a central line do you have? And then how would you like additional education, and in what form would you like that education? So we ended up with a good amount of respondents, and 57% of our current program, they were able to respond. And caregivers seem to be using more than just one method for cleaning or showering in the bath. And bathing was done every couple of days for over half. And they reported the dressing was wet semi-frequently, so that, shouldn't happen. We should be able to be safe and use two hands and have a great quality of a shower. So, and then there was openness to receiving more education, but a fairly large amount. They've figured it out as time goes on, and which is great. So this, I just went through some of the charts so you can kind of see, the questions broken down. And the majority of the respondents, bathing is performed at least once a week. Majority of respondents with tunneled catheters, they're in their chest or their back. And then you can see Tegaderm was used most frequently, Aquaguard, Hydroseal, Press and Seal, gauze, nothing. And just of interest, Tegaderm, out of the respondents, I believe it was 86%, at least sometimes got it wet. 43% of the respondents get the central line wet at least some of the time. And then, like we said, they have adapted their bathing practices over time. And then 62% would like education, 38% no. And then video seems to be. So eventually, once we make our education sheet, we will, do a video that will help. So we know that bathing and showering is beneficial to the quality of life, and we all deserve to be able to take a shower. So we do need some sort of plastic covering. We know we don't want to get it wet. We know that that increases bacteria, the chances of bacteria getting into our lines, and we just don't want that. Plastic coverings are needed for bathing. No adhesive on the central line itself, whether it be on that cap or, when you're putting the cover on, you don't want to put any adhesive over that dressing. It will just take it off. And then what products? There's products out there. There's Nista, there's Aquaguard, there's Hydroseal, there's Press and Seal. But what works best? What is going to, and granted, it's not, one size may not fit all because of where it is and the contours of your skin. Taking the dressing off and not showering at all, we've seen increases collapse rate. You may have different water. You may have well water that's not tested. So you have to be very careful with that. So keeping your central line dry is very important. Like in the 2016 article, you want to cover where the cap meets the catheter. So just putting a piece of parafilm, which is wax, you don't want adhesive. There is Valguard, sometimes that's bulkier, but covering that and then tucking it up under the, on top of the dressing, putting a gauze or pad over the entire dressing and then placing your plastic covering on usually is what works best. So we've started to gather our information for our education sheet, not complete, love everybody's input, but so we'll start our teaching sheet maybe with, a little bit of facts from the literature as I presented in the beginning, and, keeping the central line dry, free from infection and skin complications. And that's why a barrier might affect somebody's skin a little bit differently than, and the next patient. Why should I bathe or shower with a central venous catheter? How should I cover the central line with bathing and showering? And how often should I bathe and shower? So all those questions hopefully will be answered. And then a big and almost most important is our patient experience. We have patients that will come and I learned from you and all the patients every day. I learned something new and hopefully they learn something from me. But our patients will come and say, "Oh, Mary, this has really worked for me, and now I can take a shower with two hands," and I just makes my life so happy. So these skin protectors are, covering up, as I say, putting the central line on top of the dressing, putting a pad or even a paper towel over that, and then covering the whole dressing, and then putting a skin barrier around that, and then putting the plastic covering over that seems to really work for a lot of patients. And maybe in the future we may go that way, but it was a success story for some of our families, and very exciting for the families to see that and to use that. And then so that is one direction that we will probably go in. And then what are our real full next steps, I should say, because that is one of them, is we're in the process of creating a scenario in the sim lab. They have kind of made a shower area, and they're just completing a mannequin that the families will be able to go when they go to the sim lab, put a dressing on before they go home for the first time, and then put a shower covering on, squirt the shower, and put the mannequin in the shower. And then hopefully that will, really have them feel comfortable that they'll be able to shower or bathe either themselves or the patient. Engineering is working on an adhesive that will be a silicone adhesive barrier that won't be, it won't stick to the skin as much, but it will really secure the plastic barrier. We just need to find that FDA approved. There is one in France, but it's extremely costly. And then a formal education sheet, which we're pretty close to getting done, and we will have that on our external webpage so all can see. And that's what that's what we have learned, and I will continue learning. And I thank you for listening, and I thank you for all you do. And I think that should be it. So any questions?
Yeah, we can open the floor to questions if folks have any. Let me see. It looks like we have some questions about bathing and showering if you're infusing pretty consistently. Like if folks are infusing 24/7, is there any thoughts?
So again, what I would try to keep to that same policy, where I would definitely wrap where the cap meets the catheter, tuck that under, and still put a shower covering, because the remainder of the tubing would be outside the shower. So you would keep that actual central line. And you could also put with the connections, if you have any other connections, you can use Valguard. That's a wonderful barrier for water, so that you know that if any water trickles down the tubing, that it will not enter into the line. So that's a really good question.
Thank you. I'm sure this will vary, but in your experience, are infusion companies able to provide parafilm as part of supplies, or is that something folks could order?
Yeah. So we have been able to get that covered by the infusion companies, and they do send that. And we are working on, along with Aquaguard, to be able to have NITSTA sent to families. We haven't quite got there. We're trying to get that as a project in our hospital as well, so that we will have that, right from discharge for patients and safety. So parafilm, definitely, you just have to have a prescription sent. It's the easiest way. Sometimes you can call the home care company and they'll send it, but in our experience, in the home care companies that we've been working with have supplied that. Yes. Good question.
If the dressing, sorry, I have an echo. If the dressing is going to be changed immediately after, how important is it to still keep that dressing dry?
Yep, perfect. If at all costs, keep that dressing dry if you can, because even if you have that dressing on, if there's any bacteria on the outside, you just don't want anything. I mean, probably not as like panic, because you're just going to take it off and change it. But like we saw in the dialysis catheters, there's still that chance that, the water could have some bacteria in it. I mean, we can't predict all of that. So the best practice would be to not get it wet at all. But however, if it does get wet, just, deep breaths. I always say if everybody looks good, feels well, just out and just change it.
Is there, all right, I have a really bad echo. Okay. Is there any research or information about time exposed? I'm just wondering about like bath versus shower, or if it's just any exposure at all. I don't know if you can speak to that at all.
So I would say bath, probably more chance, because you could have a G tube, you could have an ostomy, you don't know what bacteria, you could have anything on your skin, probably more so. So if you can keep that dry in the bath, and that's what I'm working on. And I am very passionate about this because I really do believe that we should all have a great quality, and a shower and bathing is very much out there in the literature that it is a great, it increases quality of life and decrease anxiety. You don't want to go into that bath or shower and worry. So I want this to be a nice seal, but then also be able to get it off. Now, one caveat, if you have a barrier around, if you put the barrier around, you may need to just loosen the corners of the AquaGuard or Nister or whatever with a little bit of adhesive remover, but not all the way down to the dressing. That's all.
Thank you. This was just a tip. Someone said I'm a nurse, but was a hairdresser before this. She has had patients wrap their neck with a towel and then apply a kid's waterproof cape and stand backwards in the shower. Just if you, I guess, don't want to do all of the dressing change pieces. But again, it goes back to that quality of life piece and how much you want to do and how comprehensive you want your shower to be, I suppose.
Yes.
And then another person said, when our loved one was experiencing granulation tissue and oozing, the surgeon suggested letting the water flow over the site undressed and to dress with sterile gauze and paper tape until it stopped oozing. They've also heard anecdotes of folks who do not dress their insertion site. Is that an issue if a dressing change is completed immediately thereafter?
But that's kind of like the dialysis study. For the most part, there wasn't a huge increase in collapse rate, but there was an increase in collapse rate. So you do take that risk. And like I said, you'd probably have to research. We can't, advise that because we don't know what, do you have well water? Do you have, town water? What is the bacteria count? We don't know that. So we cannot, endorse that. And studies show that, infection rate does increase.
Do you have any experience working with patients who have vent or are on vents and or have ostomies? Have you experienced any of those sort of dual therapy patients?
I have not recommended a shower with the vent. Eventually, I would love to work with respiratory and come up with something like that. But a vent, it's, you put in we put them in a kind of a shower chair and kind of just don't get the trach or the vent obviously wet. But we haven't worked together to make some sort of a real recommendation. So yes. And what was the other part of that question? It was vents and ostomies. Ostomies, a shower, that's wonderful because then you're going to wash from top to bottom and then you have your ostomy. You can, either some people keep their ostomy bags on and keep it in the shower. Some will even take it off. But as long as that central line is covered and not getting wet, you're safe up there. That's what we want, safety and dry.
Thank you. Do you need to put gauze under the parafilm, or do you suggest putting gauze under the parafilm?
We don't suggest putting gauze under the parafilm. However, it probably would not hurt, because I always say, even with when you're covering the top of it with gauze, so if you put parafilm, put the line under, put gauze on top, the minute you see that gauze get wet, just get out and take it off, and hopefully the dressing itself didn't get wet, or the cap. So trying to minimize the amount of things that we're putting on is a part of the goal, and keep that safe so that you can go in and take a nice safe shower.
Thank you. Now we have a few more questions. Has your research shown any indications of the impact of water temperature on the adhesive properties of the different dressings?
I have not seen that, but that is a great question. It has, I haven't seen any of that in the literature. However, I mean, we know sweat can lift that dressing. And that's why I think with some of the AquaGuards and Nistas, it will lift a little. And that's why a skin protector might end up being what we need to keep that completely dry and more heat resistant. But that's a great question, and I am going to look that up.
Awesome. Thank you. Yeah, we've gotten some good ones. Do you think once the best protective dressing is established, could it eventually be used for swimming?
We cannot endorse swimming, but yes, that ultimately, depending on how long it would stay dry, but we cannot endorse swimming because there's been adverse events. However, I know people do swim, so yes, as long as this keeps it safe and dry, so that's our goal. And we are starting with bathing and showering. We don't even have a teaching sheet for that, so then it may hopefully get bigger than that. But right now we're working on bathing and showering. But great question.
Definitely. And I think with swimming, there's a lot of variables in terms of like where you're swimming, pools, lakes, oceans. There's so many different things to consider versus just well water versus city water or whatever.
Exactly.
What would you say was the biggest lesson learned or takeaway from the survey and your research?
The biggest was that most of the time the dressing got wet. That I had a 15-year-old that had never taken a shower or a bath. That, that to me just was like, oh, I have goosebumps. I just want everybody to be safe and happy. And yes, and now he actually takes a shower, and he uses, we don't have a formal education, but we reviewed it, and he takes a shower, and he's said he's so much happier. So that was my biggest takeaway from all of this, and that it really does need to stay dry to be 100% safe and to decrease anxiety and quality of life, increase quality of life, of course.
Yeah.
We all deserve to have, feel less anxious, and yes.
And take a nice shower. We had a couple of tips. Applying adhesive spray, and then somebody else suggested waterproof tape around the border has helped them. Just keeping the edge of the tegaderm or whatever they're using. Have these, I'm not sure which exact item they're referring to, but have these items been covered by insurance, or have you heard of patients having trouble getting any of these items covered by insurance?
So the NISTA, we're still working on it, okay? So AquaGuard, normally they'll send the AquaGuard, a home infusion company, and it will be covered. Like the NISTA, we're still working on. Most of the things, if we work with the home infusion companies and we send prescriptions, like the Cavalon no sting barrier, definitely covered. The new skin barrier that one of the families just introduced to me last week, I haven't even, really had time to investigate that, However, for a couple of patients, it just kept everything so dry. It was the safest they've felt in years. So I think work with your caregivers and, make sure that they're, advocating with the home care companies. I can't promise that all the home care companies are going to be the same and that they're going to cover it, but we've had pretty okay success, spinning it that, for quality of life and for safety, that these products are needed. So good question.
Thank you. We had one in the panelist chat. Are there any pre-cleaning steps that could help further mitigate infection risk, like HIPAA around the dressing prior to covering?
That would be more up to your team, how, we recommend, weekly dressings and, because we have a variety of families, if patients that may be allergic to chlorhexidine or, HIPAA or something like that. So right now, we do not have a policy to recommend that, but I'm sure that that's something that's going to come along the pipeline with, reviewing all this literature and policies.
Absolutely. Things are always evolving and developing. Do you have any, I know a lot of these are adhesives that sort of go over. Do you have any suggestions for folks who might have an allergy or be allergic to any of those adhesives, what they might do?
Well, then, I mean, honestly, for the shower, I don't know exactly what we're going to do, but we would definitely put lots of gauze and then press and seal. Now, press and seal, just remember, it does have a little adhesive, so you don't want the press and seal to, you want a secure dressing. You don't want to be putting that over the central line site itself, but making sure that, that it's padded with, and what works too is like I get a preemie diaper and it has the water indicator, and you put it over that and then put the press and seal. And if that got wet, the water indicator would change color, and then you would just take it off and your dressing would remain dry. So, I mean, that's a bare minimum, but if you have all sorts of skin irritation, that might help. Or whatever dressing type you wear, getting a larger dressing, if you IV 3000, get a really big IV 3000 and put gauze and then put that all around so that you don't break out. Then you might have to put some sort of tape to border it. Yeah, you'd have to be a little creative and work with your home care, your providers, and come up with a nice solution. I'm sure I'll work with anybody to.
Yeah, and I think that's what this comes down to also, is like what's available to you, what's going to work for you, what your providers suggest. That's, we always give that disclaimer, like we're just sharing the information, but this is great. If a dressing does get wet and is usually changed by a home health nurse and they can't come, what should somebody do in that case as sort of a mitigation?
Well, I would definitely have a backup plan and make that plan with your team, whether it's you have to go to the ER, because you really don't want to leave that on and wet, because that's when bacteria will get in. Just like if you had an arm cast or a leg cast and that got wet, your skin becomes, can be broken down. It can create bacteria and extra tissue. Just have an extra plan, whether you have to go to an infusion center, whether you have to, just so you can get it in a timely fashion, get that dressing changed.
Thank you. And someone asked, is there like a recommended size of parafilm in terms of like cost efficacy, or for folks with sort of your typical tunneled catheter? They said there's quite a few available, so they weren't sure if there was a suggested size.
The parafilm, I forget how many inches, but it's really like maybe like 2-inch in diameter, and just enough to cover your where the cap meets the catheter. So you only need a small little piece. They usually come in a big box that lasts months. It's not a sterile product. It's actually, it's wax, and it's what they use for Petri dishes or to preserve jams, you know, that big, thick covering, that's parafilm. So if it preserves jams for all that time. So it's not a medical product, parafilm isn't. Valgard is a medical product, but it can be very bulky to put under something, or some patients don't like it because it's scratch, but a lot of our families do use that too.
Thank you. You mentioned this might be a silly question, but you mentioned not using adhesives on the CVC itself. What's the reasoning behind that? Just like breaking it down, or like
Yeah,
issues with?
so adhesives, if you have it on the dressing, it's going to tear that off. If you have adhesive on where the cap meets the catheter, adhesive can create hold on to bacteria. So if there was any bacteria around that, it could seed into that cap. We don't want that. So that's why we don't use adhesive around the central line. You know, I always say tape is the best and the worst.
That makes sense. Awesome. Thank you. Any other questions from folks? Yeah, I think it's so, I'm so excited that you all are developing that education sheet, because I think that I've heard from so many people who are just starting out with a medical device, or going home with a new one, like they don't have the information, or they're told they can't bathe, and it's like that's not reasonable. So I'm excited for you to have that resource, and I hope we can share it when it
Yeah,
finally.
I think where that comes from a lot, and that's why with you know, intestinal rehab and so forth, we have these lines for a long period of time. A lot of the short-term lines, you know, you could say don't take a shower for a month, not ideal, but we don't want to say that, right? We want these lines for long term. We want to save these lines. We want you to have the best quality of life. And how can we, as a team and a community, do that? And so we will be sharing anything we find out, and I'm always open to learning new things too. So if anybody wants to reach out, I am more than open.
Awesome. Thank you so much. I know we're talking mostly about tunneled catheters in this case, but have you experienced any patients with ports? And if so, do they de-access themselves when they bathe or swim?
There's no literature out there on ports, but most of them de-access themselves. But even that, I always say, you know, wait a few hours and cover that, because you just don't know. You know, so de-access, wait a little bit and cover it before you bathe or swim. You know, because people will think, oh, it's no problem, but it does take a few hours or longer for that to be in the actual insertion site. So most will, I mean, we don't have many ports because of the long-term use and the every night use, because we've had some that, you know, break the actual skin breaks down, and it, you know, from just inserting the needle all the time. So we really don't have many, but we do have a handful that usually de-access and shower. The PIC, it's pretty much the same procedure. You want to, you know, make sure it's safe, covered, and dry. We don't want that wet. Sometimes people will put their PIC arms outside the shower, but then they say that their quality of shower and life are not the same. Yeah.
Thank you. Yeah, sorry.
Yeah, so anyway, but with a port though, with long-term PN, just don't de-access all the time. And you know, you can still use that whole, that's what we want you to use, that whole shower covering if you're going to shower with the port. I didn't answer that.
Thank you. Sorry, the mailman came. A couple of folks said there are different covers for picks as well. I think that's a little bit easier to um, manage just in terms of the placement. So there are some products out there for that as well. Um, this is kind of off base, but I've been, a patient pretty much my whole life, and in the hospital. I know it's often not a priority, but are you allowed to ask to shower when you're a patient in the hospital if you've been there for weeks?
Yes, you can. In our institution, I don't know of all institutions, but I know our institution, it's always a chlorhexidine bathing daily. However, yes, I'm sure before, after, or in between. Yes.
That's awesome. I feel like it sounds silly to say out loud.
No.
I think that's something that people forget that they can, going back to the quality of life conversation, like when you're in that hospital bed, sometimes, the chronic illness patients, we're well enough to be aware of how we feel, but not necessarily well enough to go home. So it's, to maintain that whatever degree of quality of life we can. So thank you. I just wanted to bring that
Yeah,
up.
no, 1,000%. Yeah. Try not to use I don't think we have bathtubs anymore, but they used to do that. We'd be scrubbing the bathtub, but anyway,
Oh gosh,
shower.
yeah.
Yeah.
I think they have a lot of like shower rooms at this point, but thank you. All right. Any other questions? All right.
No, and I will share as I move on in my journey, in my quest.
Yes, please, any resources or research you develop, we are more than happy to share that among our members, and we're excited to see what comes of it because it is such an important part and such a simple thing that we tend to overlook. So
And I wish I had a final whole thing, but it's it's been a journey, but I'm staying with it.
definitely. And anything good has to be thorough. So we know it definitely takes time. So well, with that, I think we can wrap up a few minutes early. Did you have any final thoughts you wanted to share?
Nope, just thank you for all you do, everybody. And yeah, you teach me every day, you inspire me, and I really love working with everybody. So thank you.
Thank you so much. I just wanted to put out another plug. Mary presented at a breakout session for us last year at our annual conference, and we are once again asking for speaker submissions through November 1st. So if you go to oley.org/2025, that will take you to our conference page for next year. Like I said, we're taking submissions until the 1st of November, talking about things like quality of life, any upcoming research, best practices. We want to hear from clinicians, consumers, members of the industry. We want some new voices this year. So if you have something you would like to talk about, please do submit a submission, and our dream team will look it over, and we'll let folks know by mid-December. But yeah, November 1st is the deadline for that. And like I said, we do have those couple more events coming down the pike this week. So we have our shortage webinar tomorrow, and then that consumer conversation video that we're hoping to show in the evening. And then we'll hear from Dr. Baskin on Friday. So that is all I have. Please do follow us on social media for any more upcoming events. I think I see a couple of thank yous coming in. Thank you so much, Mary, for sharing this. And this will be available on oley.org/webinars as a resource, so folks can share. And we'll share any resources as they come out. And I believe maybe Mary will share her slides if we're able to do that, so folks can
Oh
look
yeah,
at it.
of course, anything.
Perfect. Excellent. All right. Well, with that, we will wrap up a little bit early, and I hope to see you all at our events tomorrow and Friday. So thank you so much. Take
Thank
good
you.
care.
Have a good day. Thank you.
You.